Currently, I'm pregnant with my fourth child and see patients in the office 2 days a week. I see women across the women's health spectrum, many currently pregnant or postpartum, others going through preconception or menopause. Nothing is off topic in my office nor on this podcast. Nothing is TMI, right? So, a topic that has come up in office recently is varicose veins, specifically vulvar varicose veins. If you learn anything about me from this show, you know that I am all about prevention. Oof, but nothing is off limits. So, on this show, women deserve to know that there are options for proactive and preventative care across the health spectrum. This includes the pelvic floor. So, what does this mean? What are vulvar varicosities? Why do they happen in the first place? And most importantly, how can you prevent and relieve them? So let's go over a few quick definitions. Number one, varicose veins. These are swollen or dilated superficial veins. You may see these on somebody's leg, or you may know a mom or a friend or an aunt who struggles with varicose veins. They can be genetic, but the vein itself has gotten swollen, dilated, and it is more visible superficially or just beneath the surface, especially on the inside of the leg. You may see them. Vulvar varicosities are varicose veins of the vulva, often causing heaviness, swelling, or discomfort when sitting or standing. And these are located in the vulvar region of the pelvic floor. So if we think of that area that we sit on a bike seat on, that is that hammock of your pelvic floor. And your vulvar area is a superficial area of the pelvic floor that has veins, has blood flow, and varicose veins are swollen or dilated superficial veins, so just beneath the surface, that can bulge out and feel heavy, swollen, or uncomfortable down in the pelvic floor area. Now, this is rarely talked about when it comes to pregnancy, but it matters because when you understand what's happening in your body, you can feel empowered to make change and actually know what's going on instead of just feeling anxious or like everything is out of control and there's nothing you can do about it. So, why do vulvar varicosities happen in pregnancy? Pregnancy creates, quote, the perfect storm. 30 to 50% increase in your blood volume. That is a lot more blood flow going through those veins than when we are not pregnant. So, a 30 to 50% increase in blood volume. We often see normal pregnancy weight gain as well, which will increase pressure on your veins. There are hormonal changes in pregnancy, particularly we know the hormone progesterone is talked about a lot. And these hormonal changes can cause laxity in the blood vessels and vessel dilation or an increase in the diameter of that blood vessel. And then we also see growing baby pressing down on the pelvic floor, creating extra pressure through the area that those vulvar veins are supplying blood flow to. So all of this can overwhelm the system. It can overwhelm the vein valves that are supposed to open and close to let the blood flow through as it naturally should. But all of this can cause the blood valves, the vein valves to become overwhelmed, leading to pooling in that vein and thus dilation and swelling of the vein. So 7 ways to prevent and relieve vulvar varicosities. Number 1 would be support garments. So using compression bloomers that lift from the pelvic floor up. BOB is my favorite, and they just changed. Oh my gosh, I need the new name. I used them during my last 2 pregnancies, but they are now Love Steady. So it used to be BOB, if you've heard of it, BAOBEI. Now they've rebranded to Love Steady, but it's founded by a physical therapist, and they have some really nice support garments that are going to give you that pressure from the bottom up to create almost like a sling to create gentle compression against the pelvic floor so there's not as much room for something to swell, for those varicose veins in the vulva to swell. Think of this like if somebody sprains their ankle and we apply some compression to it, and then we apply an ankle brace to give it extra support, right? So we're doing that for our pelvic floor. So they have bloomers that are really nice. It has more compression on the bottom, but then it also comes up and over the belly. You can wear it in pregnancy, but they're also very, very nice postpartum. I will put a link in the show notes so that you can grab those. I have used them in pregnancy and then also postpartum. And it's a game changer if you start to notice some of that heaviness or that pressure in the pelvic floor, not only from a vulvar varicosity standpoint, but from a prolapse standpoint too, which can be another episode on that type of pelvic floor pressure or heaviness. Now, the second of our 7 ways to help prevent and relieve vulvar varicosities would be using compression socks. So we talked about how the blood flow can pool in our lower limbs. So using compression socks is going to help increase blood flow back up towards the heart versus it being harder for it to pump back up and pulling in the legs or pulling in that vulvar area. We talked about varicosities or varicose veins down the leg too. This will also help reduce and or prevent those. Now, compression socks, I definitely recommend in women who are struggling with symptoms of vulvar varicosities or varicose veins down the leg, but it is also helpful to proactively use when traveling. So for instance, I just flew out to Denver with my husband. We did a little hiking trip, but I wore compression socks for the flight, even though I've been having no varicose veins and no vulvar varicose veins. I just want to help my blood flow. I know I'm sitting for a while on a plane. I know there's pressure changes on that long of a plane ride. And so applying compression socks proactively can be a game changer, great for longer car trips, and then also really good if you are somebody who is standing for a long time at work. So if you're like a hairstylist and you're constantly on your feet where that blood can have a higher likelihood to pull, giving compression to help with that venous return proactively can be super helpful. I have mine from Quince, One Quince. They use really high quality materials, so reduced like microplastics or off-gassing from like an endocrine disruptor standpoint. So One Quince is where I got mine. They're really good compression socks, but you can get them from anywhere. Point 3 is going to be exercising. Exercise helps keeps our blood moving and our calf pump working. Your calf acts like a pump to literally help pump blood flow back up into your system versus if you're just standing at work for a prolonged period of time and that blood is pulling, right? So regular exercise, that can include walking, so getting out on walks throughout the day, doing calf raises and standing, especially if you notice those varicose kind of veins coming on, you're gonna help pump that blood flow back up into circulation. This is also why I created my Holistically Well pregnancy program. So this gives you physical therapy designed workouts that are going to support your pelvic floor and help address symptoms like varicose veins. So we have a whole pain point section that you can go into and click play on the relevant video for your specific pain point so that you can keep your body feeling good as you progress through pregnancy. Number 4 would be to avoid tight waistbands and groin compression. So we want to choose our clothing wisely. We want compression from the bottom up, so like those support bloomers, but we don't want compression at a tight waistband or right in that groin where it's going to essentially kink the vein and the blood flow from the lower limb up through the pelvic floor and then up into the heart. So if you wear clothes and you're like, oh, it's worse when I wear like jeans, clothes that aren't stretchy, things like that, it's your body telling you something. So listen to it. Let's not wear those. And you can again look at something like Love Steady. They have pregnancy tights as well, where they're going to help you give compression where you need it and not where you don't. Number 5 is to break up long periods of sitting or standing. So movement is medicine for our body. Your muscles act like pumps to return that blood flow. So just like I said, we should be exercising regularly. We also want to minimize periods of inactivity. So if you are going on a road trip, break up that drive with getting out and moving around. If you sit for work, if you have a desk job, find time every single hour to get up and move. I don't care if it's standing up and doing calf raises at your desk or getting up to then go get a coffee refill or to get a glass of water or to go to the restroom. Like each hour, it can be something different where you are getting up and you are moving your body for 5 minutes. And that is going to significantly reduce any kind of blood pulling and significantly reduce your risk factor for varicose veins. This is also true if you are home with a little one, right? So if you are on the postpartum end of things and you are struggling with varicose veins. Yes, we no longer have the pressure of baby through our pelvis, but we can have that lingering effect of the swelling of those blood vessels, and they may linger. So make sure you're giving yourself time about every hour where you're getting up and you're just doing a little walk around the house, or you are at least pumping those ankles. If you're really, really new postpartum, pump those ankles up and down so that calf pump is working and helping blood flow get back up and through your system. So goal is to ideally move for 5 minutes every hour just to keep that body moving and those pumps naturally helping the blood flow. Number six is elevating your legs. This is one of my favorites, feet up the wall. So you're gonna lay down on the floor, swing your feet straight up so that your body is essentially in an L position. So your trunk is on the floor, your feet are directly up the wall. And while you're in that position, you can do some little ankle pumps. That is going to help that blood flow get out of your lower legs where it was potentially pooling and back up into circulation. Just make sure that our garments are appropriate for this. We aren't having that like cinching of our clothing in our groin where it is essentially kinking. Think of like a hose kinking that blood flow from getting back up into circulation. What I also love about this leg elevation is we're reducing the effects of gravity. So if you think about whether you're sitting or standing, gravity is pulling straight down on that pelvic floor. And if we think of swollen veins that are located in the vulvar region of that pelvic floor, superficially, so just beneath the surface, right on that pelvic floor, gravity's pulling down on them, right? So if we get horizontal and feet up the wall, now we have the opposite effect in terms of gravity, right? We're pushing things up and into our body. And so that's going to significantly reduce the swelling there. That would be a great time to then, as you get out of that legs elevated position, I would stay there for about 5 minutes. If you're concerned about being on your back for that long, listen to my episode 24, where I break down why you can be on your back for short durations of time and what to watch out for in terms of symptoms that would tell you to get out of that position, okay? So typically, totally fine to be on your back for 3 to 5 minutes, legs up the wall, gently pump your ankles. When you get out of that position, apply your compression garment. So point number 1 was to get a pelvic support garment. I recommended the one from Love Steady. Put that on after doing your leg elevation, and that is going to help provide that gentle compression where we want it. And then we're putting loose garments on otherwise, or garments where we can move really well and not tight and restrictive jeans that are going to kink the blood flow in that groin. But it's going to help keep that swelling down. So that is a huge, huge, huge recommendation when I have clients struggling with these vulvar varicosities. And then number 7 would be hydration and electrolytes. This helps prevent fluid retention. It helps our water get into our cells, which is going to help regulate body swelling. So oftentimes in clients, whenever I see that they're struggling with swelling, like our water is not being absorbed where it needs to. So our cells have this exchange ratio where they need a certain amount of potassium and sodium to make that exchange happen. If we are really low in, for instance, sodium, that exchange is not happening as it should. So I love and use the Element electrolytes, that's LMNT. I use 1 packet a day in my water. I usually do it in the afternoon. I'm about to have it right after recording this episode. But it helps your hydration, your water actually get into your cells. So then we don't have that excess fluid giving added compression or swelling to our varicose veins. All right. So when we look at this from a very holistic, a whole picture standpoint, we're covering a myriad of bases, right? We're making sure that we're having compression where we want it and not where we don't. We are making sure we're getting proper hydration and electrolytes. We are moving our body and helping our muscles use our calf pump to get that blood flow back into circulation. And then when we get that swelling down, we want to be extra mindful of applying gentle compression from a form of like pelvic floor bloomer, and then maybe even compression stockings to help keep that swelling at bay. So vulvar varicosities are uncomfortable. It's swelling and pressure in an area of the pelvic floor that is not going to be comfortable to have that in when we are standing, when we are sitting, right? But they don't have to be something that you just simply have to, quote, deal with. There are things that you can do to assist them. And I hope that this episode gave you 7 actionable steps that you can take right now to help both prevent proactively these from coming on in the first place, as I have thankfully been able to do, but then also how to treat them, how to address them if they are present versus simply being told by your provider, oh, it's just something that you have to deal with, and then see if it improves after you deliver baby. Because I have had patients come into my office and say that is what their OB has told them. So please know that there are solutions, there are options for you as we outlined in this podcast episodes. So with the right support garments, safe exercises such as those in my Holistically Well pregnancy program, and small daily habits such as drinking your electrolytes can prevent or relieve symptoms associated with vulvar varicosities or varicose veins and help you feel so much better. All right, my friend, if you are wondering where to start with safe, pelvic floor friendly workouts to get that exercise in, I'd love to invite you into my Holistically Well pregnancy program. It is built for each trimester of pregnancy, so you get holistic education and movement videos that support you through every single stage of pregnancy. I filmed it while pregnant myself, and this will help you stay active, build strength, feel strong and confident, all while preventing and helping treat things like varicose veins, pelvic floor pain, and leakage. So if you would like to grab the whole program, I will drop the link below. I'll also drop a link to a free guide if you would like to get a taste for it before you fully dive in. All right, I hope this gave you a good insight into how to support your body with any kind of varicose veins. Share this with a friend who may be struggling with this. And if something spoke to you in this episode, please leave us a review. It truly helps grow the show so that more women can understand that there are resources to proactively support their body throughout the women's health lifespan. Until next time, take care and be well.